Special thanks to Kamala Boyd and Dr. DK for inviting me once more to come and share our vision with you. I'm here today serving as board president and co-founder of Fresh Moves. Food Desert Action is our parent name. We're a 501c3 organization with a triple bottom line: financial, environmental, and a community foci, whose broad mission is to create community-based driven solutions to address the lack of grocery stores in low-income urban neighborhoods. Last year when I shared our story, our vision, our hopes, this year I want to provide a snapshot of that story, but focus more about why our collective work, your work, and our nation's existence, and our existence is imperative to turning our tide for our nation's underserved communities, which is impacting mostly people of color across this country. When people aren't healthy, the impact is not only the rising cost of health care, but the drain it puts on our families and local economies. The work of FDA is one solution towards solving this massive growing domestic and global problem. I've seen solutions like produce carts in DC, New York, and Chicago, used school buses in Virginia, a truck and trailer in Tennessee, and many others. Many of us live and work in communities where the general opinion is that the community's food environment is unsupportive of healthy living. Most of our urban cities, predominantly neighborhoods of color, are devoid of consistent, quality, affordable fruits and vegetables. All of us have seen where it's easier to buy fried chickens with nuggets and gravy. I saw that last night on TV. Burgers loaded with bacon and cheese, or smoked ribs smothered with barbecue sauce, with a tall soda of our choice and probably some fries, then it's easier to buy a salad. That's not to say we don't want a salad. We just haven't seen a salad that we want to buy to continue to buy that salad. Or better yet, to even ask for it. Because in some cases when you don't have it, and most of our neighborhoods haven't had it in 30 to 40 years, it's hard to ask for better. In 2007, another colleague and myself met for lunch to talk about the state of food deserts in Chicago, based on a report, a groundbreaking report that highlighted the predominantly black and brown neighborhoods in Chicago, predominantly on the south and west sides, were identified as food deserts and what could be done about it. At the time, roughly 1 in 6 Chicagoans were living in what was called a food desert. That represented over 600,000 people, almost a quarter of the city's city's population. Geographically, these areas correlate with high rates of diet-related diseases like diabetes, obesity, high blood pressure, stroke, and high cholesterol. Despite a popular opinion, there is money in those neighborhoods, with 26 to 37% of those particular neighborhoods with annual incomes over $50,000. Mainstream grocery has generally ignored or downgraded their offerings in those communities, acting on stereotypes, fears, and in my opinion, faulty data. That Chicago Food Desert Report has been updated a couple years ago, highlighting a decrease in the people who live in food deserts based on a mathematical calculation. But we, Fresh Moves, and the demand still exists. My own immediate neighborhood has been placed in, out of, and back in based on that mathematical calculation. And the store that was in, when we were in, or out rather, is now closed. I'm not saying these groceries have not launched stores to serve these communities, but we still have an unbalanced nutritional state in these principally black and brown communities. These statistical changes still do not negate the fact that some people across this country still lack access to quality, affordable, and I say affordable fruits and vegetables, the foundational foods that can reverse the rising trend of our nation's healthcare costs. We all know that more and more Americans exercise less and do more and more sedentary activities, like sitting for long periods of time, playing video games like our youth, Facebooking and Twittering, or watching television. Being sedentary is one of the precursors to major health diseases, and the lack of consistent consumption of fruits and vegetables will accelerate that person. Let me highlight a few healthcare costs today by disease, so we can frame not only its impact for today, but the future on our domestic society. Recently, American Diabetes Association reported that 25.8 million children and adults living with diabetes, and almost 2 million new cases every year, at a cost of $245 billion, and that does not include the 75 million that are all pre-diabetic and on that trajectory. According to the Centers for Disease Control, more than 35% of U.S. men and women were obese in 2009 and 2010, and among children and adolescents aged 22 to 19, more than 5 million girls and approximately 7 million boys were obese over that same period of time. Estimates show that the annual medical burden of obesity alone has risen to almost 10% of medical spending, amounting to $147 billion on the last calculation in 2008. Almost 50% of these individuals who are obese are African American. The CDC identifies stroke as a leading cause for all death for all Americans. But the risk of having a stroke varies, with African Americans running the risk of having their first stroke nearly twice that of whites. African Americans are more likely to die following a stroke than whites, with a national cost upwards of $5 billion. 71 million people live with high cholesterol at a cost of $18.7 billion, cited by the CDC. Do I need to go on? You see where this is going. We don't have that money, but this is growing. These small examples tell us we need to do something. I'm talking billions today, and by 2013, direct and indirect costs of these diseases are expected to reach close to in the trillions. Where's that money going to come from? With just these few examples, you get the sense we need to make innovative, or better yet, disruptive investments in our education, our food policies, as well as our declining urban and physical infrastructure. We need to think beyond what exists today. In all these cases, people of color are the major consumers of these bad habits and poor lifestyle choices, and based on limited access through social, racial, and economic backgrounds. Nuance front, let's not talk about the personal freedom conversation going on in New York today over big sodas and just recently targeted cigarettes. Or better yet, for my folks in the Southeast, the conversation going on in Mississippi and the anti-Bluebird conversation. While all the while holding down the crown for #1 in obesity, but yet you don't want to take away my freedoms about choosing about what I should go in my Happy Meal. These very reasons are why it's imperative that individuals and everyday citizens become engaged around creating innovative solutions to solving this problem that's seeping into the global marketplace. Recent evidence in Asia, Latin America, and Africa that inactivity and poor diet is one of the leading causes of obesity in those countries. FDA is just one cog in the wheel to achieving health equity. We try to provide unencumbered access to affordable quality produce to jumpstart a healthy lifestyle, while combating unhealthy alternatives like Flaming Hots as a snack. Yes, we trade a bag of Flaming Hots for a kid for an apple. I call that marketing, or they call it marketing. I just call it smart. We not only distribute and sell quality, affordable fruits and vegetables to underserved communities, but we also educate our consumers. Knowing our capacity, we work with partners to deliver this, because we can't do it all. We partner with Kendall College, a liberal arts college who has 3 foci: business administration, culinary, and early childhood education. To date, we sample with that school. Let me give you a sample of what we do. That business school has helped us with everything from marketing surveys to operational critique to also serving as a class lecturer. And I've even served as a graduation speaker for that college, because the president of that college wanted me to show folks that you can do something in your part-time life, and we'll get to that in a minute, and still go out and make your money. At some point, you can still do good. So having that as a graduation speaker before they turn their tassels. The culinary department prints recipe cards for our participants on the way for free. One of those cards, as an example, is we actually give you a recipe of how to make kale chips instead of potato chips. Because we cook our collard greens to death, we show you how to cook them in a different way. Hopefully, we will start to work on their, as a quid pro quo, help them with their early childhood nutrition program. You see where this all comes in, a great partnership. Those culinary students actually got out of that college and helped us when we actually were doing education at 5 farmers markets in the community last year. So they came out and did community demonstrations. We recently partnered with a couple of large property management firms because they realized they could assist their residents in their health trajectory by bringing us instead of waiting on the grocery magnets to figure it out, and realize these folks just don't want more junk. They actually want healthy stuff. Architects for Humanity, and those in the community, listen to this one. Architects for Humanity is a local and an international organization that does design work, cutting-edge design work, for free for nonprofits. They have actually helped us design our first design book, and when we went to the Chicago Transit Authority with our initial idea, hey, give us a bus, that meeting lasted 5 minutes. Not because of our bad design or because of a bad presentation, but because these architects put together a design book, quality design book for free, that at the end of the day, the conversation moved from not what are you going to do with our bus, but when can you come pick it up and how many more do you need? Because in some cases we need to unlock the visual, because some people don't know what you're talking about because they've never seen it before. We've got to actually help people see this in a different way. So having a partner like Architects for Humanity helps us visualize that, and all of our funders help see that in a different way. On their own, they've entered our design work, their design work, into numerous international and national competitions. Just this week, we won a design competition in the area of architecture and farming because of that Fresh Move design, and will be awarded that prize in New York on May 16th, just this week. On May 23rd, 2011, Food Desert Action rolled out Fresh Moves, the first urban produce market retrofitted from a full-size city bus to quickly and effectively bring fresh food to the Austin and Lawndale communities. To date, we've served over 10,000 customers, had almost over $60,000 in sales over those almost 2-year window, have moved countless cases of fruits and vegetables, and now serve both the south and west sides, and soon to be the north side, through this innovative but undefined public-private partnership with the city of Chicago. These stops we go to includes elementary schools, high schools, senior buildings, hospitals, clinics, a community center, and a youth service agency, just to name a few. Fresh Moves has been the subject of over 100 local and national and international stories since our launch, including pieces on NBC Nightly News, CNN, Univision in Spanish. Did you catch me? Univision in Spanish, which isn't shown here in the United States, it's shown internationally. The Nation and the public radio's The Story. Our story has even made it to the White House. We are included on Michelle Obama's cookbook. So talk about impact, turn to page 194. You'll see a picture of an ex-offender working on our bus and a story from me in that cookbook. We all do all of this with sales associates, a driver, and a recently hired executive director, who are the backbone and soul of our work. While I know this is just one small way to bring about health equity, I hope it serves for you a real way that everyday people can impact what looks like an insolvable problem. It is going to take all of us using our disciplines in a complementary, innovative fashion. We may see things differently, we may approach it differently, but we must be on one accord in knowing what ends we want to arrive at. We must work to find one voice for those who are voiceless. Through the work we choose to do, we must be ready to demonstrate our commitment to that work. Talk of health equity and food justice is just the beginning to be parts of national conversations and missions of newly formed organizations. We now see, however, it's still a fragmented conversation. The intersection of big business, personal health, healthcare, and privacy create a paradigm of slow, if not flat, innovation towards solving our issues. The challenge for all of us is to figure out how to get beyond our individual wants and needs in order to accomplish something for the common collective. This means we have to begin to think differently. We have to understand the trade-offs of what health equity really looks like. Are you willing to say, I'm willing to have a ban on a soda in my community if that means I can't, am I willing to have a ban on soda in my community that means I can't buy what I want? Then that means we can start to turn this tide when you accept that. Fresh Moves, the mobile produce market of Food Desert Action, means hope to my community. A hope that things will get better. When that red bus rolls into community and parks at these community health centers, housing projects, elementary schools, people overall are encouraged to do better. They feel appreciated. They feel like someone has been listening and hearing their concerns. A woman in the neighborhood told me one day, "You can't be from corporate, not delivering this in this way, because you actually heard what I asked about 40 years ago, because corporate ain't delivered on it in 40 years. You can't be from corporate." They feel the bus and staff have become an integral part of the communities we serve, and the residents can feel that. We get this from seniors. We tell seniors we're gonna show up at 3 o'clock. At 2:57, the phone is ringing on the bus. "You ain't here yet." "Oh, well, we're on our way. We're stuck in traffic." "No, you ain't here yet. You said you're gonna be here at 3 o'clock. That means you should be open and ready at 3 o'clock, not pulling up at 3 o'clock. I remember on one of our first trips out, a senior got on and shopped. She commented that this bus was providing something as basic as fresh fruits and vegetables. Can't be anything more than divine order. It had to be something else. That interaction and many others like it continue to demonstrate that this solution and other solutions like it are needed. We have to honor where our communities are. We have to be smarter about how we do that with less money and less time. The challenge for FDA faces now is how to manage growth, because we can be everywhere and implode tomorrow. How not to let our growth outpace our ability to find and secure funding. Since I was last year, we hired an executive director, additional staff, and another bus to service neighborhoods, as I mentioned previously. Many funders like Chase Bank Foundation and Michael Reese Health Trust and others are drawn to our work because they understand the need and see the direct impact in the community. However, the sale is not always that easy. FDA has been educating funders along the way as it relates to the restrictive funding metrics they bring. The benchmarks we're being held to are similar to a grocery store. I'm a nonprofit. I am not a grocery store. I'm not for-profit. I'm not a grocery store, but you're holding me to those measurements as a funder. I feel we should be measuring people served in sales, or even a new crazy metric such as people served in the programs delivered to body mass reduction. Let's think about something different. We've been part of focus groups the FDA has put on and participated in some short-term student-led projects. But there's pressing for funders to think differently and think differently about measurements. I had that conversation with the U.S. Department of Agriculture's Tom Vilsack when he said, "What's stumbling your growth? It's being held to candles like same-store sales, which isn't my issue because I'm not a store and I just launched, but that's the measurement they judge us on. That's how stores look at their growth in the for. We need to be able to do our work, but have a longitudinal focus of our impact on the community, which requires funding over a period of time and patience waiting on outcomes. I repeat, patience waiting on these outcomes. But we know bureaucracy has little patience and is sometimes only there for the lights and the 5 p.m. headline. So again, all of us have a part to play. Some of us are thinkers, some of us are workers, some of us are connectors, and some of us can be funders. Whether our individual goal is to help one or help many, impact policy or start a business, we should all be working from the same reference point to bring about health equity. We should be making ourselves think of things that don't already exist, thinking outside the box. I'm working to increase availability and reduce the cost of quality produce for those who live in communities without access. Let me also add, in closing, that I am both a proud husband and a father, and could not have accomplished all of this without a supportive and phenomenal spouse, my wife, sitting up here. We have 2 sons, Michael and Joel, 2 and 8, who keep us on our toes. By the way, the litmus test for some of the ideas I come up with is through the lens of my 8-year-old. If he gets it, the funder's probably gonna get it. When he doesn't get it, the funder's probably not gonna get it. At some point we need to stop being overly complex Break this down very simple and deliver. My son gets the bus and the reason based on our neighborhood. My wife and I strongly believe enough in our neighborhood that we become investors by acquiring local rental properties within walking distance of our home. Lastly, I do all of what I just talked about by working professionally for the John D. and Catherine T. MacArthur Foundation. I manage as a grant budgeter. In my role, I'm responsible for an $80 million grant budget and about a $5 million administrative budget. And I hold organizations accountable to carry out our foundation's simple mission, to create a just and verdant world. So I hope some of you fellows, when you saw I couldn't get on Twitter and Facebook and was real slow, now you see why I don't have time to do that, because I'm doing something else. I give my time differently. In all of my personal and professional travels, I carry with me a long life-lasting perspective from my father, who was a police officer, and my mother, who was an accountant. You can either be part of the problem or part of the solution. My life has chosen the latter. The combination of all these perspectives and experiences have formed my own idea of social justice, and in my opinion, the requirement that we all have to do our part. I'm doing mine. Are you doing yours? Are others doing theirs? How can you be the catalyst for somebody else to do theirs? I thank you for this time, and I hope this inspires you to insert yourself into that problem, whatever that problem is. Whatever that problem may be, and be a part of solving it. Before I get to questions, I want to show a video, because I think this video will give you a snapshot of our work. Because again, some of this is visual. Some of this you need to see.